Welcome back to the Holistic Health Bites podcast. Today, we're going to discuss the most important markers that I look at when I'm evaluating a client for overall metabolic health. Now, a few instructions I recommend for my clients before getting their blood drawn. I always recommend this testing be done in a fasted state, ideally about 12 to 14 hours fasted. This generally means you're going to want to get the blood drawn in the morning. You do want to be well hydrated the day before and the day of the draw, but don't have anything other than water the day of the draw. You don't want to do any strenuous exercise a day or two before the draw either. The normal muscle breakdown that occurs with exercise can alter some of the levels related to liver enzymes. This isn't necessarily a problem, but it can look like you have elevated liver enzymes. You also want to be aware that some medications and supplements may need to be avoided before the draw, as they can alter various markers. You always want to find out ahead of time if you're taking any of these that need to be adjusted. B vitamins, for instance, especially biotin, can alter thyroid markers. Some medications or supplements will need to be skipped for up to a week, so be sure you ask early. You also do not want to have your blood drawn on a particularly stressful day or if you're feeling under the weather. Reschedule it when things are back to normal. Okay, now I run a very comprehensive panel, so I am not going to discuss every single marker I look at, but I'm going to talk about the top 10 that I look at related to metabolic health. I'm going to run through this whole list of markers, but I want you to know that I don't hyper focus on any one marker. I'm going to look at combinations of markers and overall patterns. Lots of things can throw off a single marker, so it doesn't necessarily mean you have a problem. The first marker is fasting glucose. Ideally, we want this between 70 and 90 milligrams per deciliter. This is your blood sugar level. Elevations in blood sugar can be due to developing insulin resistance, prediabetes, diabetes, high stress levels, an underlying infection, and even certain medications. Low levels can indicate liver imbalances, elevated insulin, or adrenal imbalances. The second marker is fasting insulin. Ideally, we want this number between 2 and 6 microunits per milliliter. Elevations in this number can indicate insulin resistance, prediabetes, diabetes, or other pancreatic issues. Low levels of this hormone can indicate type 1 diabetes, issues with the pituitary gland, or even some other pancreatic issues. The third marker is hemoglobin A1C. Ideally, we want this between 4.1 and 5.3%. This is a marker of how much sugar has attached to your hemoglobin protein. This can give an estimation of how much sugar has been in your blood over the lifetime of your red blood cells. Elevations can indicate insulin resistance, elevated blood sugar averages, iron deficient anemia, nutrient deficiencies, or other issues with your hemoglobin. Low levels can indicate low average blood sugars, hemolytic anemia, blood loss, or even some kidney issues. These values can also be altered based on the health of your red blood cells. If your cells are dying early, there's just less chance for the sugar to have attached, so your value will be artificially lower. If you are exceedingly healthy and your cells are living longer, there's more opportunity for sugar to attach, so your value may actually show increased. This isn't actually a problem, but we have to take it into context with the entire client picture. The fourth marker is triglycerides. This is going to be found on your standard cholesterol lipid panel. Ideally, we want this between 50 and 100 milligrams per deciliter. Higher values can indicate that you might not be metabolizing fat very well. You might be taking in too many carbohydrates. You may have high blood sugars, liver imbalances, thyroid imbalances, heart disease, or be taking in too much alcohol. Low levels can indicate that you might be not getting enough fat in your diet. You might have a vegetarian diet, liver or biliary dysfunction. You might have overactive adrenal glands, low stomach acid, or you might be over-exercising. The fifth marker is HDL. This is also found on your standard lipid panel. Ideally, we want this between 55 and 75 milligrams per deciliter in males and 65 to 85 milligrams per deciliter in females. High levels can indicate some autoimmune disorders, certain medications, underactive thyroid, or too much alcohol intake. Low levels can indicate high carbohydrate intake, liver dysfunction, fatty liver, low-fat diets, oxidative stress, diabetes, or metabolic syndrome, heart disease, overactive thyroid, lack of exercise, or even heavy metal exposure. The 6th marker is uric acid. Ideally, we want this level between 3 and 5.5 in females and 3.5 to 5.9 in males. High levels can indicate oxidative stress, inflammation, gout, leaky gut, kidney insufficiency, insulin resistance, fatty liver, obesity, or cardiovascular disease. Low levels can indicate oxidative stress, poor detoxification, zinc or iron deficiencies. The 7th marker is LDH, or lactate dehydrogenase. Ideally, we want this between 140 and 200 units per liter. High levels can indicate liver or biliary dysfunction, cardiovascular disease, anemia, tissue inflammation or destruction, certain viral infections, biliary obstruction, fatty liver, or other liver imbalances. Low levels can indicate reactive hypoglycemia, or low blood sugars, keto adaptation, or insulin resistance. Again, we have to take this into the context of the client. The 8th marker is AST. Ideally, we want this between 9 and 21 for females and between 12 and 26 for males. High levels can indicate some coronary artery dysfunction, developing congestive heart, liver cell damage, liver dysfunction, alcoholism, pancreatitis, or even diabetes. Low levels could be a B6 deficiency, alcoholism, protein deficiency, or you're not absorbing protein very well. The 9th marker is ALT. Ideally, we want these levels between 10 and 19 for females and 13 to 22 in males. High levels can indicate liver dysfunction, autoimmune hepatitis, biliary tract obstruction, fatty liver, cirrhosis, or any kind of injury from alcohol, drugs, or medications. Low levels can indicate some liver imbalances, early stages of fatty liver, B6 deficiency, too much alcohol, protein deficiency, or not absorbing protein very well. And the final marker is called GGT. This is another enzyme that the body makes. Ideally, we want this between 10 and 24. High levels can indicate dysfunction in the biliary tree, biliary obstruction or stasis or insufficiency, too much alcohol consumption, liver cell damage, liver dysfunction in general, pancreatitis, pancreatic insufficiency. You could have a deficiency in glutathione or oxidative stress. Low levels can be a need for magnesium or more protein or not absorbing protein very well. Now, of course, we're going to combine all of these markers with the rest of the markers that are going to evaluate kidney, thyroid, iron, blood cell health, immune system, etc., in addition to the client presentation, symptoms, medications, and overall health. All combined, this informs us on the direction to take your personal protocol for nutrition, lifestyle, supplements, or medications. Now, I don't personally deal with the medication side. Your medical provider should be included in any changes you're making. Do you have questions about these markers? Email me. Do you want to run your own panel and get a comprehensive review of your results? Order your own labs in my online store and I will do a detailed dive over your results with you. I'll leave a link in the show notes. Until the next, be well and vibrant.